Okay, so let's continue with our second lecture. Our second speaker is Professor Kamarul Imran Musa, or better known as Prof. Kim. Okay, Prof. Kim is epidemiology and statistics and medical epidemiologist at the School of Medical Science, University of Malaysia, USM Malaysia. He is a gazetted public health physician from the Ministry of Health Malaysia and the fellow of the American College of Epidemiology. He is the principal investigator for Newton Engku Omar Fund, an international grant where his team collaborates with researchers from London School of Hygiene and Tropical Medicine to offer solutions to caregivers for stroke patients in Malaysia. He's also leading a fundamental research grant, FRCS, that tries to understand the role of clinical characteristics for breast cancer diagnosis using statistical and machine learning methods. He leads another research university grant examining cardiovascular and stroke risk among Malaysians. He has authored or co-authored more than 150 articles, indexed by Scopus with over 65,000 citations and page index of 48. So we have a very esteemed and very expert speaker here. So without further ado, let's welcome Prof. Kim to continue with your lecture. Okay, over to you, Prof. Kim.
Assalamualaikum warahmatullahi taala wabarakatuh. Thank you very much for your kind words, Dr. Noani, Head of Bureau Penyelidikan and also Director IKU, and Dr. Muhammad Fadli, my good friend, and also the head of the Center of NCD IKU. So indeed, it is a great privilege to be here to talk to all the participants for our seminar today. And so I'm very happy with what Dr. Fadli has presented. I think it has made my life much easier. So he has touched many important things, but very fundamentals when writing research proposals. So, I think Dr. Fadli has touched on the theory and also on the experience that he has faced before. So I think those are actually goals or a must lah. So thank you, Dr. Muhammad Fadli. And so I'll continue with the talk. My talk is writing methodology section in research proposal. Right, writing methodology section in research proposal. So all right, my slide doesn't move. Okay. All right. So a bit of myself. Thank you, Dr. Noani, for introducing my background. So I'm a professor at School of Medical Sciences. Now I'm looking at also I'm also coordinating research at Campus Kesihatan USM. So I'm telling you all this just in case there are potential collaboration moving forward. So I'm very open for collaborations. I'm also the coordinator for the Unit Science Kesihatan Digital School of Medical Sciences, the head of cluster research for the digital health and also digital health profession. And also pakar perubatan kesihatan awam, fellow of the American College of Epidemiology, and also ahli panel penilai program kepakaran perubatan MMC. So I'll talk about first motivations for writing a research proposal. Right, I think it's very important to understand why we write research proposal. Right, okay. And number two, motivation for writing methodology sections. Part of my talk basically overlap with what Dr. Fadli has talked before, and I'll go next to how to write or how to have a general structure of methodology section, and the structure for qualitative study, methodology writing, and also a bit of my experience as a panel looking at methodology sections and what on some of my comments, right? So I think very important that when you write, write what we call a research proposal, it's basically to uh, present evidence of thorough research. Okay, so when you write a research proposal, as Dr. Fadli has mentioned before, it will demonstrate to others that you have thoroughly considered your research topic. Okay, we cannot, we should not write a half-baked proposal. Okay, it must be a complete and detailed research proposal. And then you have a clear plan for investigation, what you need to do from A to Z. Okay, from A to Z, what are the things that you need to do when you want to do the research? So it tells people that you are well prepared. Okay, you are well prepared. I mean, there are funders who want to give you money, right? 10,000 ringgit, 50,000 ringgit, 100,000 ringgit, 500,000 ringgit, 1 million ringgit, and they are not happy if you are not well prepared. Okay, so because when they give you the money or the funding, it is an amanah, right? Amanah, and they have to find the right people to for them to give the money, and then they have to be very sure that the, like Dr. Noani mentioned just now, the return on investment, okay, the ROI uh, uh you know are good. Okay, right. Number two is, when we write a research proposal, we want to secure funding most of the time. All right. um so yeah, I mean, there are research projects that don't have funding, but most of research project at the end or in the middle or during executions must need must need money, right? So part of the research proposal is basically to seek funding for the project. And also maybe to get approval. If you are a student, you have to write a research proposal because there is a requirement from the graduate school before you start your thesis or dissertation writing. Okay, you can't do thesis dissertation without research, and and you can't have research without proposal. Okay, so it comes in sequence. So and then when you present your research proposal, it can convince your educational institutions or your supervisor that your research is worth pursuing. So Dr. Fadli has mentioned about that, and I think and it's very important. And also to formulate a plan. So when you write a research proposal, you will tell people that, okay, these are the steps that I'm going to do to conduct my research. So when you have to do that, you have to think. Okay, you have to think what I'm going to do for my methodology, what I'm going to do for data collection, what I'm going to do for analysis. So when you are forced to think about that, then you have to think, you have to come up with plans and activities, and when you do research letter, it would be much better compared to um, without having a proper research proposal. Okay, right. So I'll go very quickly because Dr. Fadli has mentioned about this. You write research proposal because you can look at different angles, you can consider alternative, you can refine your research questions. At the same time, it also spark creativity and new ideas. I think I'm very sure Dr. Fadli has seen research proposal that looks similar. People have done that before. Okay, so if Dr. Fadli sees that again, then he might not going to approve it because somebody has done it. Okay, and there is no novelty, there is no new data that you are going to gather. So that's it's also important. All right, and then in the research proposal, methodology is one of the critical element or critical heading or critical chapter in a research proposal. Okay, because in methodology section, you will outline the approach or the methods that you will use when you want to conduct the research. Okay, what are the approaches? What are the methods? Are detailed in the methodology. So that's why it is very important. Okay, so much or so much detail that when other people want to do another study similar to you, they can just look at your proposal and they will be able to do that without the need or without having to call you, to consult you, to ask you. So it must be up to that extent. Okay, right. So when you write your methodology, you must provide detailed description on how the research will be carried out. What are the techniques that you are going to use? What kind of procedures that you are going to use? What are the tools that you are going to also use during the study later on? So it's so detailed, it's so structured, uh, you know, to the extent other people can replicate. Okay, I think that's a very important uh, key understanding. Methodology is so technical in such a way that other people can do your study without without the need to come to you and ask questions. All right. Okay. Um, So it also look at the validity and reliability of the methods that you are going to use. Okay, so if you have a well-defined methodology, so people will, or the results or the data that you are going to have later will be valid and reliable. What do we mean by valid? Valid means that your research study what it's supposed to study. What is reliable? Reliable means if other people use your method, they will get the same results. Okay, so reliable, repeatable. Okay, so um, so in research methodology, you will need to outline the steps that you are going to take to collect the data, to analyze data systematically, one, and rigorously, meaning that it got to have enough detail, and then it should minimize the bias and the errors that you are going to do when you do your research on the field later on. Replicability. When you write a clear methodology, you will tell people that, this study or my study is so structured, so organized, so detailed that, other people can replicate the study. They can also verify your finding. They can also do other research, similar to your research. Okay, so I think replicability is another important thing in your research methodology. So you have to ask yourself, when I write a research methodology or methodology in my proposal, is it clear enough for other people to read it and do it on their own? Okay, right. And alignment with objective. Dr. Fadli mentioned that in research proposal, you have to have research objective, right? So you have general objective, you have specific objective, but you have to have objective. 3 objective, 4 or 5, I think 5, 6 will be good, 8 will be too many, 10, I think obviously too many. But when you write your methodology should be aligned with the research objective that you have written. Okay, if you got objective 1, 2, 3, the methods that you are going to use will be relevant to objective 1, objective 2, and objective 3. And it should demonstrate the methodology in the research proposal must be able to demonstrate how the methods that you are going to use address the research objective, address the research problem, and also contribute to the knowledge in the field. In methodology also, you have to consider the ethics. Ethics is very important. Ethics is sometimes can make you angry, right? So but it's an important element in methodology because the methodology that you write must address ethical issues. How about the informed consent? How about confidentiality? How about data protection? Do you have that information in the methodology, right? So when people look at the methods or in your research proposal, people will see that, oh, okay, the study will be ethical. The study have enough information about how they will protect confidentiality, how they will protect privacy, and how will your research letter protect the data. Okay. So again, if you look there, that what I mean by valid and reliable. Valid, it means that your methods is is uh, is so is correct. It means that it measures what it wants to measure. Okay, the objective are this 1, 2, 3. The methods are valid. Okay, reliable mean when you use the methods and other people use the method, they will get this similar result. For example, when you want to do a study on hypertension, you use a reliable and calibrated, for example, blood pressure machine. Okay, and then if you use like a cheap manual blood pressure, then maybe you pressure you when you measure the blood pressure in your study for patient A, you'll get like 120 millimeter mercury. But if other person use that blood pressure and they'll get like 80 millimeter mercury. So that we mean by reliable. It means that the results are replicable when other people are also doing the study. And worse is when the methods is not valid and the methods are also not reliable. Feasibility. In feasibility, you must show that your research that you conduct later is feasible. So feasible in what way? Okay, you present the resources that you need. You also tell us about the time constraint or the time that you are going to take. You also tell us in the methodology where you are going to study, who are going to do the study, who are going to help you. So all the resources, time, money, logistics are there in the methods. So so when I or Dr. Fadli review your proposal, then we can see that, oh, your methods are so practical, so grounded, so what we call practical, it can be implemented. We are confident that it can be done. So it's going to be a good research proposal. Next is about justification. In the methodology section also, you might need to justify why you choose the methods. Okay, so you got research questions, right? And then you got research objective, and then you choose these research methods or specific design or specific analysis. You must be able to justify why you choose such methods, such instrument, such tool, such sample, in the study. So, so it will support the objective and the research questions that you have mentioned before, like what Dr. Fadli has mentioned. In methodology also, you might need to discuss the strength and limitations. These are something that people, sometimes missed. They write a good research. I mean, they write methodology, right section, but they don't know the strength and they don't know the limitations. Okay, and they don't know the alternative methods. Okay, so so you have to be more prepared. Okay, you have to know. Okay, I'm using this and this and this in my research methodology, and what are the strengths? I'm using this and this and this for my research later on, and you write that in your methodology. But what are the limitations of my instruments? For example, okay, you use a DAS questionnaire: depression, anxiety, stress, The other one is what? Score ke? Okay, forgot. But DAS questionnaire, for example, what are the strengths of DAS? What are the limitations of DAS questionnaire? Maybe one of the limitations of DAS questionnaire is that it is not a diagnostic instrument. It is like a screening instrument, right? So when you later do the study using DAS and you get the result, you cannot say that if someone's is considered as depressed in from DAS instrument, then he is indeed depressed, as defined by psychiatrists. Okay, so you have to know that the limitations and also the strength as well. Right. All right. I hope I'm not too fast. If too fast, let me know. Right. So okay, now that's basically the concept. Okay, I want you to understand. Okay, in the methodology, those are the things that you want to put forward, right? So when you write the structures of methodology, okay, usually you can have introduction to methodology. Sometimes if time is limited, you don't have to provide introduction to your methodology. You can just go straight to methodology. It must include research design. What is the research design that you are going to use, and then you must understand why you choose such research design. Okay, why you choose that design? Why case control? Why not cross-sectional? Why a cohort study? Is it a nested case cohort study? Okay, so you must state the research design. Okay, done. But be prepared when panel asks you why you choose such research design. Okay. In the methodology also, you write how you will collect the data. What are the specific methods that you are going to use to collect the data? Maybe you are going to use surveys. Maybe you are going to use interview. Maybe you are going to observe. Maybe you want to do some experiments, or maybe you want to get, old data, but the data collection method must be specific. Provide also details on how participants will be recruited, will be selected, what is the sampling strategy, what are the inclusion and exclusion criteria inside the methodology. And then next, go to data analysis methods. I won't go one by one because it's a bit too technical, and actually the details usually are defined by the funder or the organization that offer the research project kan. But roughly, you have like data collection, then data analysis. After that, in data analysis method, you should outline the procedure that you are going to use to analyze the collected data. So what kind of statistics that you are going to use? Is it a purely quantitative study, or is it a qualitative methods, or is it a mix of qualitative and quantitative method, or mixed methods analysis? But it is not just that you have to be more detailed. Remember what I've told you just now, that so detailed that people can replicate your study. Okay. Describe how the data will be processed, how they are going to be coded, how are you going to interpret the research question, and also the test objective. So in data analysis, sometimes it's good to say like, okay, for objective number one, I'll do this. Objective number two, for the analysis, I'm going to do this. For objective number three, the analysis for that is this, blah, 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 blah. Okay. So that you know that from objective 1 and 2 and 3, you don't miss. Okay. Right. Validity and reliability. If your instruments, if you are using instruments questionnaire, for example, then describe the validity and reliability of the instruments, but not just a questionnaire, but also machines or test kits, always think about the validity and reliability. So when you put in your methodology, I'm going to use test kit A for the study, you can either um, put an additional information there about the validity and reliability of the instrument. At the same time, be prepared because panel might ask you, why you use test A? Why not test B? Why not test C? So it means that you also have to know other alternative for the test, and also the validity and the reliability of other tests. Okay, if you don't know, it's okay, no problem. But if you are fighting for a grant, right? And you just know only instrument A, but your friends know about instrument B and C. So most probably he or she will get the grant or the funding and not you. Okay. In the methodology also you describe the ethical considerations. Okay. Again, like I mentioned before, the informed consent, the confidentiality, the privacy, what are the potential risks to the participants, and be prepared. If panel asks you, okay, how are you going to make sure all those, things that you mentioned about ethics are going to to happen in your study. And in research, in methodology, also you can write limitation. This is also something that many people forget. They thought, okay, I have written methodology, so my methodology is like 100% foolproof. Okay, very strong, concrete. Nobody can comment on my research methodology. I think it's false. Okay, you have, you know, nobody has written or will ever write a perfect methodology in a research proposal. So you have to know what are the limitations, and you have to write in the methodology what are the limitations of your methods. It could be limitation in terms of your sample size. You can't get like the complete sample size. Maybe limitation in terms of the machines that you are going to use, or maybe limitations of the analysis that you are going to use, or maybe the data or the sources of data. For example, some variables are missing, or some variables uh, are not properly collected, so on and so forth. Sometimes, not every time, in methodology you provide the milestone. Not all the time. Sometimes funders will ask you to provide the milestone in the methodology, and also Gantt chart. And Dr. Fadli has also touched about milestone and Gantt chart before. Okay, this is one tip that I can give to you. When you write your methodology, okay, you don't write like this, but I want you to imagine, okay, or I want you to take a piece of paper, okay, write a rubric, okay. The first column, write the objective. Remember, you have like maybe 2 or 3 or 4 objective, right? So you write down objective 1, 2, 3, and 4. And then you have the next column, which is population sample. What is the population of interest? How are you going to sample from this population of interest? Next column. What is the data source for objective number 2? What is the data source for objective number 1? What is the data source for objective number 2? And what is the data source for objective number 3? Because sometimes in the project you can have like different objective, and this objective use different data, and this objective use different data. For example, if you are doing a study where first objective you are going to do systematic review, so data source will be papers from Scopus, Web of Science, or Medline database, right? And the second objective is premature, okay, I've written there, right? For example, estimate prevalence of premature CVD, using systematic review from 2000 to 2020. So the data source, are basically articles that you screen from Web of Science, Medline. Okay, data collection. How are you going to collect? So maybe you are using some software for to retrieve the paper. What are the variables? So variables are not variables in this are basically variables that you are going to use for systematic review. What are the assumptions? What are the analysis you're going to do? So you say that I'm going to use systematic review analysis, but be very detailed. What kind of systematic review analysis that you are going to use? What are the limitations? Number two, describe risk factors for premature CVD among Malaysian population using population-based data from 2000 to 2020. So the population would be Malaysian population with premature CVD. Maybe sample would be premature CVD patients or participant retrieved from NHMS study, for example. Data source NHMS 2000 to 2020. Data collection will be not relevant. Variables will be, sex, age, something. What the assumptions that you are making? What are the analysis that you are going to do to describe that? You say maybe mean, standard deviations for numerical data, percentage, and in percentage for categorical data, and so on and so forth, right? And what are the limitations? For example, the limitations of that data is that it's use questionnaire, for example, so the tip that I'm giving you now is a rubric, put in nice rubric, and then I think if you do this, you will not miss, or your chance of missing important methods will be, you can minimize that. Okay, right. And then in project milestone, you can also, in the methodology, provide the project milestone. Okay, so in project milestone, it's different from project task, because in milestone, it refers to a point. Okay, it's not an interval. It's a point. Okay, a point that the project change in stage of development. So it will tell your team or the stakeholder that you are progressing forward. So it doesn't have, like duration. It's just a date, a date, 0-day duration, a date. Usually a diamond shape icon, and that is accomplishment about. It means that, okay, I've reached this milestone, I've reached this milestone, I've reached this milestone. That's a good, team information about this on that link. This a simple milestone. For example, you write there first. Milestone ni apa ni? Yang macam itulah kilometer. You know that, okay, I'm going to KL. Okay, kilometer 30, kilometer 100, kilometer 300. It means that you are getting nearer and nearer and nearer to KL, right? If you got stuck at kilometer 50, stuck there, it means that you are not progressing. Okay, so milestone is very important. So, for example, milestone that this is an example, right? First, develop the first draft of a systematic review paper, end of February 2025. Okay, just one activity. What is the end date? Obtain ethical approval, end of April 2025. Complete preliminary analysis of premature CVD, end of June 2025. Develop models of risk factors for premature CVD, end of August 2025. It means that it completed. The model, the model is developed. So we have successfully developed models of risk factors by end of August 2025. Submit paper. It means that end of December 2025, you pun submit paper, right? So it means that, you are progressing. And then it is different with Gantt chart, because Gantt chart, it has interval, right? Interval. So this is a simple Gantt chart. Okay. For example, a research proposal, it happened between January to April. So you expect that, end of April, you will obtain ethics approval. And then while waiting for research approval or ethic approval, ethics approval, you are gonna do systematic review analysis. All right. So and it can overlap. If you see here, it can overlap. It is not like straight line. It can overlap. And then you can do preliminary analysis even in March or April, even though your research proposal is still ongoing, because you can if you are using, for example, some modeling, right? You can learn how to use modeling. You go to GitHub or whatnot again, so you can do preliminary analysis even without getting the ethical approval. And then you do modeling, even not completing your preliminary analysis. Okay, you can start doing some basic modeling, but the modeling process continue from May to August. Right? So don't wait. Okay, don't wait until like, okay, I've got the research proposal already. Now I move to systematic review, or I finish the systematic review. Now I'm going to use preliminary analysis, because that will slow down your project. Okay. And drafting paper, you don't wait. You don't draft paper at the end of modeling. You can draft paper even before that. During the data modeling, or even during research proposal, you can draft your paper. All right. So, but the star there shows the milestone. Okay. All right. All right. But if you want a fancier Gantt chart lah, something that is like look prettier and beautiful, you can go to free online Gantt chart software, for example, right? So I think this is a video that I just did it this morning. So let's see if it works. So you go there and you can change. Okay, this is my this is just example, kan, premature CVD project. Okay, then you go to example task number 1. What's going to be is research proposal, right? And then task number 2, systematic review analysis. Task number 3, preliminary analysis, for example. Then you move to the table to your right, and then you edit lah, kan? Edit. In this case, kan, you have to edit lah the date, kan? That is like March 17, based on days, kan? But I think in research project, you can put like weeks or month. I think weeks lah, weeks. Then you can drag it, until when, Then, okay, for systematic review, you say, okay, I want to do earlier, maybe, while waiting for research approval, I'm going to do systematic review analysis, and then preliminary analysis. I'm also going to do even when I'm doing systematic review. And then you can change the duration there. Right. So, yeah. Change the duration for the systematic review analysis. Okay, from 10 days to maybe 5 days. In this case, kan, kalau it's a long-term project, then you have to change like the date, kan, from days to weeks, for example, right? All right, I think you got the point, right? Okay, let's move on. Right. So next is structures for qualitative study. I think I'm going to go very, very quickly. Okay? I don't want to offend people from qualitative background. You are also important, okay, even though I'm a quantitative person like Dr. Fadli, but we love qualitative people, all right? So don't get offended, right? So qualitative study is also important. All right. So basically, in when you write methodology for qualitative study, it's the same. You can write a small introduction about your methodology, talk about research design, what are the sampling strategies, whether it's snowballing or theoretical sampling, what is the data collection method, interviews, focus group discussion, participant observations or document analysis, so on and so forth. Qualitative people knows about this much better than me, right? But you have to have also this. And then what kind of data analysis that you are going to do? Thematic analysis, content analysis, narrative analysis, discourse analysis, fancy name. When you when you do data collection, what kind of instruments that you are going to use? What kind of tools you are going to use, kan? For data extractions, what kind of instruments you are going to use? Um, so on and so forth. Okay, I'm not a qualitative person, so I don't know much, but yeah, qualitative study is also important, and you must also write a good methodology for a qualitative research proposal. Okay, you also have validity and reliability issues, so you must make sure that you are going to use valid methodologies for your qualitative study. You must also make sure that the methods will have information about reliability of the things that you are going to use for your methods. Right. Ethical consideration, the same. All right. Informed consent, confidentiality, anonymity, participant right, reflexibility, and also understand what are the limitations. Write down, not just understand, but write down in the methodology the limitations of your study. Okay. Methods, every method has their own limitations. So you must know that, all right? Right. Next, what are the common common weakness common weakness just a second, yeah. What are the common weaknesses in when you write in methodology section in a proposal? Okay. Number one, lack of clarity of detail. Okay. Not enough clarity, not enough detail in the methods. Okay, if you write, a very superficial methods, that's not good. Okay, reviewer will have time to struggle to understand, and they will not be happy. There is no adequate justification of your method. Okay, you cannot defend your methods. You present your methods, okay, and then of course there will be questions. Luckily for our research grant proposal, we don't have presentation. Okay, you just submit your proposal and we will review. We will not call you to present. Okay, but you have to have justifications. So there are proposals that have inadequate justifications, sampling issues, inadequate sample size, lack of representativeness, inappropriate sampling methods, bias and confounding. So what are the bias in the methods? Okay, and if there are potential bias, then you should have ways to minimize the bias in the methodology. How are you going to minimize the bias in your study? What do we mean by bias? Bias means error lah, wrong thing. Okay, let's say you want to study depression, anxiety. You use DAS questionnaire. For some people, it's wrong. Okay? It's bias because DAS questionnaire is not for depression and anxiety. For clinical setting, for example, right? Okay, I might be wrong, but that's how you look at it. Confounding, okay, confounding. For example, you want to study, association between coffee drinking and heart attack. Okay, you say I want to study a new hypothesis. There I hypothesize that there is a relationship between coffee drinking and heart disease. But what are the potential confounders? Maybe smokers, maybe age, maybe sedentary lifestyle. Okay, you have to consider that in your methods, right? Limited generalizability. It means that can your study infer the general population or the population of interest? If your study is very small, very limited, then you cannot generalize to the population of interest. Okay, for example, you want to study about diabetes mellitus in Malaysia. For example, you say, oh, I want to describe the fast-seeking behavior among diabetes patients in Malaysia. And then you in your method say I will study diabetes patient in Kampong ABC. And then is that is that does it generalize enough to the population of Malaysia? Of course, this is not right because it's only in a kampong, right? 1,000 population. So, so it is not good, all right? So it is not good. Ethical consideration. Some methodology does not contain enough information about ethics considerations. They don't have, they don't provide details about how they are going to, the informed consent. They cannot address potential risks when people when the panel asks, okay, what are the potential risks when you take this blood? They don't know what are the implication, right? Or if you do a study, a clinical trials, a new medications, they don't know, what are the potential risks. So cannot. You have to know that. And also, I think another thing is about data. How you secure your data, right? I'm not a fan where you say that after 7 years you will destroy the data. I think all data are useful. I think you must keep the data. In fact, in open science initiative, data sharing, I think it's very very important that don't destroy the data, but keep the data, but make sure how you are going to keep the data or how are you going to share your data properly. Okay, insufficient attention to validity and reliability. You mentioned you want to use instrument A and instrument B, but you don't know. Sorry, you say you want to use instrument A, but you are not sure about how valid it is. You are not sure about how reliable it is. So it is not good, right? Right. So coming to our research proposal for PKM grant, I want to take this opportunity to encourage you all to to apply for our grant. Okay, we got a 10,000 ringgit grant one allocation and 5,000 ringgit grant two allocations. In the research proposal for PKM grant, provide the study title, what is the field of study, describe the background, provide the introduction, provide justification and rationale, what are the research questions, what are your research objectives, general and specific, what are the methods that you are going to use. Okay, the methods part are relevant to the one that I'm talking now. Ethical consideration, expected outputs. So there is a link there. There's a link there. I think I'm going to share the slide with all of you later. But the link is also available on PPPKM website. Okay, you can go to our persatuan punya website. At the same time, yang mana dah jadi pakar perubatan kesihatan awam, sila jadilah ahli PPPKM. Okay, right. So what are the expected outcomes from your research? The project timeline. Which are you, how much budget you want, 10,000 ringgit maximum or 5,000 ringgit. Provide references or provide appendices if necessary. And as a panel, I when I look at specifically for methods, okay, specifically, I can see first, I can perhaps categorize weaknesses or issues with one character of the presenters. Number two, the technical skill of the presenter. Number three, the scholarly experience of the presenter and the resources that the presenter has. For example, the in terms of character or personality, the presenter is not motivated. And when they tell us about the methodology, it's like there is no spirit there. Okay, I think you have to present your methodology with with conviction and excitement. Okay, so you have to convince the panel, and I think even though it is not not written, but I think it's important. Number two is you have to have technical skill. It means that when I listen to them, I know that they don't have the required skill. You know, it's just that maybe someone asked them to prepare or ask him or her to prepare the research proposal, so they write the methodology, but they are not really have skill or have the technical necessity for the methodology. So at the end, when we ask the presenter, some questions, then we know, okay lah, okay, that lack of details, and sometimes too much detail. It's also not good, right? Too much details, too much detail. Okay, so so you have to find that sweet spot where it's not too less and this not too much. Okay, sedang-sedang aja. All right. And scholarly, it means that okay, when you present, we want to see you. Okay, scholarly, it means that you don't follow format. No, you just okay, Dr. Fadli has mentioned. Okay, we need to have this and this and this and this. Okay, but you come and then you present like, why? Wait, which format are you using? Right, all right. And then lack rigor. Your when you write the proposal, or it shows that you have not gone through enough literature. You have not gone through enough review. You have not gone or you have not talked to enough expert, so we can see that, okay? And then not your expertise. Usually this one paksa rela lah kan. Someone ask you, okay, you do a research proposal, and then you kata macam mana ni. So you have to write your methodology secara paksa rela, and we know that okay, this must be another case of kena paksa, okay. And then resources, too time consuming. You are too excited. You say, I want to do everything under the sun, right? I say, come on lah, this grant is only 10,000 ringgit. You can't do a 3-year study based on 10,000 ringgit, right? And two people consuming, it means that you want to study the whole Malaysia using 10,000 ringgit grant. Possible, maybe possible, maybe not possible, right? So you have to use a lot of resources. So again, you have to find that sweet spot, how to convince people that I can do this, everything is in place, I got enough activity, I got enough details, not too less of details, not too much of details, right? So yeah. Thank you very much. This apologies for shameless promotion. So you can email me if you got questions at drkamara@usm.my. I've got a Facebook drkim29, a Facebook page there, and also a Twitter Kamaru_Imran, and also if you want to follow me on Instagram, macam promotion pula, Dr. Noani, sorry. You can I'm also on Instagram drkim03. So I would like to acknowledge Persatuan Pakar Perubatan Kesihatan Awam, which I think is a very important persatuan, and I hope that more pakar perubatan kesihatan awam can join us and can be more active. I would like to say thank you very much for Dr. Noani, who sangat-sangat committed and work tirelessly to to make sure that the research agenda not just dekat KKM and also dekat persatuan pun berjalan, and Dr. Fadli, who always help us, and also I have to also to acknowledge that I use generative AI, Gemini AI, ChatGPT, and also Microsoft Copilot for this presentation. So with that, thank you very much. So I pass back to Dr. Noani.
Okay, thank you, Prof. Kim, for a very comprehensive lecture. So we're open to question either from the chat, or you can even raise up your hand and pose your question to Prof. Kim. So I notice here one question from Dr. Lo Song Yang. I have a question on sample size calculation. Let's say I want to do a retrospective study on firearm-related death in Sabah from 2012 to 2023, although this type of death are uncommon and there isn't any prevalent study done before this. How do I calculate the sample size without previous prevalence or expected frequency? Can I assume the expected frequency of a sample if I'm using FP4 to calculate sample size? Okay, Prof. Kim, any comments how to help out Dr. Sunya?
Yeah, I think that's very good question, Dr. Lo Song Yang. If you okay, sample size, is an important element in research methodology, right? So you have to write, you have to calculate and write and report sample size calculation in the methods. Okay, if you don't have information about, for example, you want to do a retrospective study on firearm related death, and you want to know the one objective is to estimate the prevalence of firearm related death in Sabah. Okay, first, if you are not lucky, you don't have any information. So in that case, you have to talk with expert in firearm related death and ask them, okay, what do you think in 1,000 population or 10,000 population in Sabah ni kan, how many cases of death happen? So use the expert opinion. Number two, you may ask them, okay, can you go through your data and see how many? It means that, get rough data or rough information from their data. Okay, maybe you want to do in Sabah, but you have, you can maybe go to KK, in KK, just ask to, get information about what would be the prevalence or what is the prevalence of death in KK, and then from there you say might be the same prevalence in Sabah. Use that as your guide. And so so that would be, I think, a possibility how to calculate sample size if you have previous prevalence or previous data on that. And then you can use whatever software, AppInfo, or the other one is OpenAPI, and there are many web-based sample size calculation nowadays.
Okay, and thank you, Basim. Another one here from
Sorry, Prof. Dr. Low here. I am the one who posed the question. I want to clarify. Does that mean that when you said rough data from the estimating the prevalence, that means that in the methodology, I will have to state the limitation that I estimate the prevalence rate based on experts punya advice or their experience in Sabah kah? Contoh macam tu.
Yeah, of course, you have to. So that the limitations of your sample size lah. When I think definitely when you go to the sample size calculation, right? You say the sample size was calculated based on the expert opinion from blah blah blah. The expert estimated the prevalence at what? Okay, so that will raise not alarm lah, but depending on us. Okay, are you sure about? Are you sure the expert are really expert? Are that trustworthy or not? So that's the common follow up questions lah. Kan Dr. Noani kan?
Okay, thank you, Prof.
Thank you.
Okay, another question here from Dr. Aziza. What do you think of research using secondary data? Rakim.
All right. Research using secondary data. Research is research, whether it's primary data where you go and collect yourself, or secondary data where someone else has collected and has kata apa ni has kata what we call that analyze or did something with the data, so it becomes secondary. For me, doesn't matter as long as is data, whether primary or secondary, it's gonna be useful. It's just that when you look at the call for proposal, for example, they usually state lah, okay, this must be primary data ke, ataupun if they don't state that, it means that you can use primary or secondary data.